I was in so much pain. I couldn't even walk from my car to the hospital. My husband had to bring a wheelchair.
After a C-section, Cecilia said she was repeatedly sick and felt very unwell, but she was sent home. Then 8 days later, she was rushed back into hospital with suspected sepsis.
So yeah, I went into surgery and I didn't wake up. I was put in induced coma for 12 days. At some point, they didn't know if I was going to wake up. They called my family a couple of times to say goodbye.
When you started to figure out what had happened, when was that? How long after? And then what were you thinking?
So when I woke up, my legs and my hands were necrotic. And I couldn't move for weeks.
When you say necrotic, do you mean that parts of your legs and hands had died at that point?
Yes. So they were black. So I lost all my fingers on my left hand. This is a prosthetic hand. I still have a bit of trauma showing my hand,
Of course.
as it is. And my feet couldn't recover, so I had 2 amputations below the knee.
Alongside Cecilia are a group of parents, campaigners and solicitors who have worked together to get to this point of an independent inquiry into Leeds Teaching Hospitals NHS Trust. This is Fiona and Aliona's story.
I was screaming, why isn't she crying? And there were more and more people rushing into the room. And I felt like I'd floated up out of my body, that I was having this out-of-body experience. And then I knew it, I felt it, that she had died.
What do you think is the scale of this? How big could this be?
We have, over the last 15 years, acted for hundreds of families who have claims arising from their accessing maternity services at Leeds. I think the full scale of what is happening there will only really be known when the inquiry takes its course.
Leeds Teaching Hospitals NHS Trust told us they couldn't comment specifically about the families we've covered because of patient confidentiality, but their chief executive has spoken broadly about the inquiry.
I want to start by offering the families an unreserved apology, not only for their experience, but also for the fight that they've had in raising these concerns. And I want to assure them of our commitment to engage with the independent inquiry openly, honestly and transparently.
This is the latest in a line of inquiries about maternity care. You've had Telford, Shrewsbury, Nottingham and now Leeds. You always hear these stock phrases of recommendations and lessons learned. What difference will this inquiry make to families?
What does the future look like for you?
I'm trying really hard to do as much as I can to be here for my daughter, to try to show her the world that I wanted to do. I dream with the time that I will be able to take her to school.
While the families here in Leeds are grateful to the Health Secretary, they're now calling on him to appoint a leader they trust to begin to get the answers they deserve.